Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share. It really means a lot to me. Just got back from the clinic today. We actually went through some interviews for some clinical research administrative assistants, and we ended up interviewing and found two excellent candidates that we're going to hire and onboard next month. And one of them is an international medical graduate. The other one is a phlebotomist. So there's a lot that Guru Nation, I hope, can get from this. Whether you are a job seeker, I think you need to understand the fundamentals and understand what small sites need. And I think if you're a site, you need to open up your horizons and really look at your community for bringing on raw talent and training them. And we have things like the CRC Academy that can help you. But today I got two questions. I got one from an international medical graduate who asked, what's the best way for her to get her foot in the door in San Antonio. And I told her, don't sit around and wait for job openings on Indeed or on LinkedIn. I mean, you might find some, but the thing is, so is everyone else. What you want to do is get to these sites before they even decide, hey, you know what, we need someone, let's make a post. Because my site, Yuma Clinical Trials, we hire in waves, and one of our staff let us know, gave us like a 2 months notice that she's going to be moving to San Diego. And so we were needing someone else anyways, even if she wasn't moving. And when she told us that, then it was like, okay, we really need to get serious about hiring. And we actually ended up finding two people. The point is, there was a time between when we already needed someone else, one or two people, and by the time we actually posted our post on Indeed. That was like a 3-week gap. Now, if somebody would have just walked in, handed their resume to somebody at the site and said, hey, I'm looking for a job, that would have saved us some trouble. Nobody likes to go through the interview process. If you're a job seeker, you may not like going to interviews. Guess what? Us site owners, we don't like doing the interviews. I have done so many. I turn them all into like an educational session, and it's like not very efficient use of my time. But we go through the process because we got to filter through all the mediocre candidates. Some are bad, to get to the one or two that are diamonds in the rough. And that's who I think we found today. But the point of all this is, again, you want to not compete if you're a job seeker. You want to go find these sites, and you have no idea when they're thinking about hiring versus when they're going to make a post. I understand. But tomorrow's available. Go into a site near you. Wednesday's available. Go to a site near you. Thursday's available. Go to a site near you. Find them on social media. Message them. Go multiple times. Follow up. That shows persistence. And if you have any resemblance to who they are looking for, you might be a step ahead of everyone else. Otherwise, if you do what everyone else does and just click refresh on Indeed or get alerted automatically when a new job gets posted, if you do what everyone else does, you're going to get everyone else's results. But if you do things differently, you're going to get different results. And so that's kind of my advice to this person. Sites love international medical graduates. We just hired one today. And there's a lot that international medical graduates can bring of value to the site. And if you're an international medical graduate, you are already ahead of the pack, but just put yourself even further ahead and go to sites. Get out of your comfort zone and just go. Just show up. Now, you don't want to be rude. You don't want to be obnoxious. You don't want to keep going when they tell you no. But you do want to go once or twice and talk to somebody who's a decision maker there. And just at least get your resume out there. Now, I got another question from a Guru Nation member that says, hey, does everyone need to be on a delegation log? We have somebody that just does regulatory at our site, and do they need to be on the DOA log? The answer is yes. And then the next question was, okay, if they need to be on the DOA log, do they need to have a CV and GCP on file? And the answer is usually yes, but as with most things in research, there's not any hard and fast rules. It's what does the site's SOP say? And you got to go look at the site SOP, because I'm telling you, a lot of these SOPs say all of our staff have GCP training and a resume on file. And if your SOP says that, and then you have somebody on a DOA log without GCP training and without a CV on file, that's an issue. So that's something that you need to look at as far as your SOPs are concerned. Now, if your SOP says only individuals involved in the clinical aspects will have good clinical practice training, but everyone will have resume, I mean, it's fine as long as you can justify it. And that's what most things in this industry, if you can justify it and give a good rationale as for why, and make sure that it is compliant with good clinical practice, then you're okay. And you might get some sponsored pushback, and then you might find yourself having to change your SOP and do what the sponsors want. Because at the end of the day, it doesn't matter what the FDA guidance says, it doesn't matter what your SOP says. At the end of the day, if the sponsor is not okay with something, and it comes down to they're not going to use your site, I guarantee you your site is changing your policy if that keeps happening. So figure out a few things. Every site should be checking for when their coordinators' GCPs expire. Like, subscribe, comment, share. Bye-bye.